tonight by Dr. Janae Caldoun, our Chief Medical Officer, and Captain Emmett McGowick, the commander here at the State Emergency Operations Center. We're here today because we have identified the first presumptive positive case of coronavirus in Michigan. We're taking every step that we can to mitigate the virus spread and keep Michiganders safe. I've signed an executive order declaring a state of emergency in order to maximize our efforts and assist local governments and officials to slow the spread. Now, it's crucial that Michiganders continue to take preventative measures. There are easy things that we can do to lower risk and risk of transmission. Wash your hands often, for 20 seconds at least. Practice touching your face less often. Replace handshakes with elbow bumps. Cover your mouth when you cough or sneeze. I know these sound simple, but they work and they will help mitigate the spread. The main goal of these efforts is to slow the spread of the virus, not to stop it. It has moved into Michigan, and I urge all Michiganders to take these recommendations very seriously, to share this information with their friends and family and coworkers. For those of you who have questions, the Department of Health and Human Services has set up a new user-friendly website at www.michigan.gov/coronavirus. Earlier this week, I created 4 task forces to help combat the spread of coronavirus. The task forces are focused on education, health and human services, our economy and workforce, and state operations. They're already meeting to discuss further preventative measures that we can take. The coronavirus has the potential to impact our lives in nearly every aspect of our lives. So these task forces will help us slow the spread in those particular areas. Dr. Janae Caldoun and the team at MDHHS have been hard at work. We're Michiganders. We're tough. We know how to take care of each other. We will get through this. But for now, please make sure your families and friends are taking every preventative measure available to keep yourselves safe. Talk to your friends and your family and your coworkers and encourage them to make smart choices. We in state government will continue our work to take every necessary precaution to keep Michiganders safe. Thank you. With that, I'm going to pass this over to Dr. Janae Caldoun, who will now talk more about MDHHS's efforts.
Thank you, Governor. As the Governor mentioned, today we learned of the first 2 presumed positive cases of COVID-19 here in Michigan. These tests were performed at our state laboratory here in Lansing. While these tests still have to be confirmed by the CDC, we are proceeding with the public health investigation and response as if these are positive cases. So again, there are 2 cases that we confirmed today. One in an Oakland County resident who had a recent history of international travel. The other is a Wayne County resident who had a history of domestic travel. We are working very closely with our local public health partners to learn more about these cases so we can do everything we can to protect those who may be at risk. These are the first known cases of COVID-19 here in the state of Michigan. It is very likely that we will see more cases and that there will be community spread. We need everyone to do their part to prevent the spread of the disease as much as possible. As the Governor mentioned, washing hands with soap and water for 20 seconds every time, appropriately covering sneezes and coughs, sanitizing frequently used surfaces often, and staying home if you are ill. All businesses, employers, hospitals, schools, and universities should be making plans and appropriately preparing for this disease. We've been working very closely with our partners across the state for several weeks on these preparations. For those who are elderly or who have chronic medical conditions, you should consider postponing any long travel, staying away from crowds, and making sure you are not going on any long plane rides. This is a rapidly evolving situation, and we will continue to do everything we can at the state level and working closely with our local and federal partners to protect Michiganders.
With that, we'd be happy to answer a few questions.
Can you say more about where the individuals travel internationally and domestically?
At this time, we're still working with our local health departments to identify more information, so we do not have that information at this time.
Okay. And are friends or family of these two individuals now being tested as well?
So as part of our local health department response, our local health departments will be working to identify who may be close contacts of these individuals and making sure they are appropriately tested if necessary and monitored.
When did the state learn of these positive tests?
We learned of those this evening, a couple of hours ago.
Governor, can you talk more about the state of emergency? What does declaring a state of emergency mean in terms of this virus?
Well, it means that we are going to take all reasonable and necessary steps, and there is a lot of authority within that. Moving forward with the task forces, I believe that we will have probably some additional steps that we'll be able to share with you tomorrow as we reconvene and pull everyone together now that we have presence in our state.
Are you considering other states that have been cancellations of major events, schools, other gatherings? Are you considering that?
Well, we're going to make decisions based on the facts as they present and based on best practices. We're going to keep Michiganders safe, and we're going to be prudent. We opened up this state emergency operations center a few weeks ago in an abundance of caution, and I'm glad that we did. We've got all of the experts at the table. I'm actively in conversation with the White House and my fellow governors, and I think that we'll have additional steps probably to share with you in the coming days.
The individual that traveled internationally, did they travel to China?
I do not have that information at this time.
Do you happen to have the ages of these individuals?
They are both middle-aged.
And then the gender, sex as well?
One is female and one is male.